Hello, today we'll be conducting Megan's head-to-toe health assessment. I let Megan go to the bathroom already this morning to fully empty her bladder. And we got her vital signs at a different station. Her blood pressure was 112/72, her oxygen is 100% on room air, heart rate was 82, and she had a temp of 97.6. Megan is 26 years old, and she is 5'7", 125 pounds. And we will, for our video purposes, have already completed the vision Snellen chart. Megan does wear glasses, so she is compensating, but that's okay. We will first start with inspecting Megan's head and face, looking at your overall structure of your skull, noting the positioning of her ears and her eyes, and I will be palpating your facial bones and your sinuses. Let me know if you have any tenderness. You okay?
Yes.
And while I'm doing this, I'm looking at her scalp and her hair as well, just making sure that everything is without any abnormalities. Moving on, can I have you smile, please? Can you wrinkle your chin? Puff your cheeks? Stick your tongue out and say ah. Throughout this exam, too, we will be completing the neuro part of the exam as we go along, and then I'll kind of recap at the end, so good. Using this, I'm just testing some of your light sensation. Can you feel that?
Yes.
Same on both sides?
Yes.
Good?
Yes.
Good. Fabulous. Okay, so now looking at your eyes, observing the external part of your eyes and your eyelashes and your characteristics. Your sclera, looking at conjunctiva, and testing your pupillary reflex. Good.
Yeah.
And then also palpating her lacrimal apparatus, which looks good. She has no discharge. Looks fabulous. And so we'll be moving on now to her near vision screening. I'm going to hold this for you.
Okay.
Cover one eye with that. Can you read the first line, please?
EFACDPC.
Switch eyes and read the second one.
BCDZATL.
Perfect. Okay. So I'm also going to do just a few more eye exams for you. I'm going to first start with just this cover and uncover test, checking for any strabismus. She's great. And then also examining for her red reflex. Fabulous. And one more eye exam, Megan. We're just going to be testing your extraocular movement, which actually does test cranial nerves 3, 4, and 6. So I'd like you not to move your head and just follow my finger, okay? Great. So that does cover some of our neuro exam as well. Okay, moving on to your ears. So for your ear exam, we always just look for the positioning, make sure everything looks symmetrical, you're not drooping on either side. I'm going to palpate your auricles, let me know if there's any tenderness. I'm also checking for masses. No tenderness? Just going to peek inside your ear here. Great. So I just looked at your ear canals and your tympanic membrane. So we're going to do the Ryan and Weber test, which is also part of your neuro exam. I'm just going to strike this tuning fork. Let me know if you hear it better at placement A or B, okay?
At A.
Okay, perfect. So now I'm going to strike the tuning fork and place it on your head. Let me know if you feel it, if you hear it more in the right or the left, or if they're the same.
Same.
Great. Okie dokie. Moving on. So I'm just now going to be looking at your nose your nasal structure, making sure that your septum is not deviated and you don't have any abnormal nasal mucosa or turbinates. Also noting just the characteristic of her skin, nose, and hair. And moving to your mouth. I always just start by observing just her general mouth structure, making sure that it's symmetrical and that her lips are not blue or jaundiced or anything different. So I'll have you open your mouth, please. I'm just looking at her gums, her oropharynx, pillars, tonsils. Can you stick your tongue out for me? Looking at the characteristic of her tongue, looking at her teeth, making sure that she doesn't have any missing teeth. Your tonsils, pillars, uvula, fantastic. And then this is also part of the neuro exam for a glossopharyngeal in vagus, but I'm going to stimulate your gag reflex. Okay. Great. Perfect. And now moving on to looking at your neck. So, always start by just once again making sure everything looks symmetrical. Your thyroid looks good, there's no masses or swelling. Also looking for jugular vein distension. If you did, we would want to assess that further. I'm going to have you, I'm going to push against your head and you push back, okay? Great. And now this also tests another cranial nerve, spinal accessory. And shrug your shoulders. Great. Okay, so now I'm going to palpate all your lymph nodes, including the pre- and post-auricular, occipital, tonsillar, submental, submandibular, superficial, cervical chain, posterior, cervical, deep cervical, supraclavicular, and that is it. I'll just run through those really quick. Now I'm also feeling her temporomandibular joint, which I did do in her head and face assessment, but just making sure there's no clicking. Perfect. Okay, and now I'm just going to, one more thing before we move on from your neck, just auscultate your carotid arteries and your thyroid, listening for any bruits. And I'm also going to just palpate your carotids one at a time. And your thyroid, and just making sure that your trachea is in line and it's not deviated in any way. Great, so we're going to move on now. I'm going to have just assess your upper extremities. If you could just stick your hands out like this. I'm just looking for her skin color. She has a lot of freckles. Feeling her pulses. Checking for any temperature changes or edema. But she looks great. Great. So I'm going to have you kind of shift.
Turning towards one.
Yeah, shift that way. I'm just going to be looking at her back and her posterior side here. I'm just looking at her thoracic configuration and looking at her costovertebral angle. You sitting okay? Mm-hmm. Okay. Back that. So I'm just palpating and percussing for her costovertebral angle. Okay. So while I'm back for two, I'm also going to be starting her lung exam. But just looking and palpating, watching her lungs expand, making sure that her chest rises and falls symmetrically. Can I have you say 99 for me? 99. Perfect. Just assessing her tactile fremitus. And now I'm percussing posterior, laterally, and I'm also testing her diaphragmatic excursion. Now I'll be listening to her lung sounds. Okay, so moving on to the front of her chest, the anterior part of her chest. Just looking for any additional pulsations. Once again, watching her respirations, seeing if she does have any extra abnormalities. She's breathing comfortably. There's no heave. She's not using any of her accessory muscles. She looks great. I'm just looking at her. I'm going to percuss and palpate your chest wall and your precordium. And locating her apical impulse. And I'm also feeling her axillary nodes and her interclavicular nodes. Perfect. So I'm just going to be listening to her heart sounds as well as her breathing sounds in the front, including her mitral, her herbs, her pulmonic, and her aortic heart sounds. Tricuspid mitral. And we did percuss before as well when I was finding your apical impulse. Okay, so now I'm going to have you lay down for me. We'll get you comfortable. Okay. We're just going to do your abdominal exam quickly. You see okay? Okay, perfect. So we first start by just inspecting her overall abdomen, making sure that she's breathing and moving appropriately and her contour is correct. Megan, can I have you lift your head for me? Perfect. So this just tests her abdominal muscles, making sure that she doesn't have any hernias or any masses that may be arising when she does use her abdominal muscles. So we always begin with auscultating. I will auscultate her bowel sounds and then move on to her arteries as well, including her aorta, renal, iliac, and femoral. Great. So once we're done with that, I'm just going to percuss for her quadrants and then also be locating the borders of her liver and her spleen. She looks great. And so now we're going to be moving on to her a little bit of light palpation. We want to feel the borders of the liver, spleen, and kidneys during deep palpation, but for light palpation, we're just testing if she has any tenderness, any masses that we can feel, anything like that. So, and we always want to have the dullness of the spleen with percussion. So we'll start with light palpation, and then we'll move on to deep. Megan has very active bowel sounds. Great. So after we're done with light and deep palpation, we already tested her abdominal muscles, so her abdominal exam is complete. I'm just going to move on. For the purpose of this video, we did not have a gown for Megan to wear, but I will be looking at her legs, looking just for her skin, her color, hair distribution, if she has any temperature changes, any edema. Take your shoes. Okay. Sorry. Perfect. And then just feeling her pulses, her popliteal, her pedis, her tibial. And we're also, in other patients, we do want to be making sure that we note if they have any edema. That's a big cause for concern. Okay, so Megan, I can have you sit back up. Okay. So we've completed most of the neuro exam throughout the video so far. we can assume that her olfactory sense is intact. Her optic was tested during the eye exam. Abducens, trochlear, and extraocular was all tested with the 6 fields of gaze. So the only nerve that we really have left here is just the nerve number 5, the trigeminal. We also already tested your spinal accessory with the shrugging and your vagus and glossopharyngeal. So I'm just going to touch you with either a soft or a dull object, and I'll have you close your eyes.
Okay.
And stick your arms out for me, and palms up. And just, can you tell me if this is a soft or dull?
Soft. Soft. Dull. Dull.
Great. And then 2 feet. Is it soft? Great. Okay, so her senses are all intact. She's doing great. She's doing well. So last but not least, we will be testing your musculoskeletal. So I'm just going to test your reflexes, and then I'll have you do some basic exams here. So just do your brachial first. I'm going to bend your arm like this. There we go. Great. Knee. Great. And her Achilles. Great. So can I have you stand up, Megan? I'm just going to check your cervical spine. Make sure it's all aligned. You're not suffering from any scoliosis, are you?
No.
All right, can you stand in front of me? Are you able just to bend down, touch your toes? Just checking for your scoliosis if you have any. Okay, you're great. Stand on up. Can you do a squat for me?
Squat.
Squat. Perfect. So her hips and all her flexors are in shape. Okay, turn towards me one more time. Stand, and can I have you close your eyes? Perfect. So your Romberg test is negative. And then can I have you walk straight to the dresser there on your heels?
Okay, heels.
Perfect. And then about face on your toes.
Come back.
Come on back. And she did great. So Megan, you can have a seat. That concludes Megan's head-to-toe assessment for the day. I wish we would have had a gown for you, but that's all right. So, okay, Megan, well, you have a great day.
Thank you. You too.